welcome to Beauty Doctors by Cocoona with me, your host Nidhi Kumar, where we talk about all things beauty. But before we get on with the show, introduce our celebrity guest today, can I please tell you, just look around at our new beautiful set. When I entered the set today, I was filled with energy to start the new season of Beauty Doctors, and honestly, I am supposed to be up there, but let's just go past that. Today, we have a celebrity dentist on our show. Literally every Bollywood celebrity that you could think of, any Bollywood celebrity that you would want a selfie with, he has worked with them. From the Bollywood A-list actors, Shah Rukh Khan, Ranveer Singh, Ranbir Kapoor, Sanjay Dutt, to every beautiful Bollywood actress that you could think of, from the social media sensation, Deepika Padukone, Jacqueline Fernandez, and so many more. From Preeti Zinta to Katrina Kaif, everyone, he has worked with them. And also the god of Indian cricket, Sachin Tendulkar. And I'm so excited that I'm going to be talking to him today, and we call him the Bollywood Smile Doctor. Welcome to the show, Dr. Sunil.
Thank you, Nidhi.
Thank you so much for joining us. And literally, the list that I just mentioned was not even quarter of the people you worked with, and you get the opportunity of meeting the people who we want to meet. And I really wish I worked at your clinic. If you have any vacancy, I'd come. Before we start on with the show and we talk about all your work, I want to tell my audience that there is something extremely exciting at the end of the episode, where we are giving you a free laser teeth whitening worth 2,600 dirhams with none other than Dr. Sunil himself. So stay tuned, because at the end of the show, I'm going to give you all the rules and you all can participate. So let's get on, Doctor.
Sure.
It's an honor that you're here on our show to start the season.
Thank you.
So this is generally a question that I keep for the end,
Okay.
but I'm going to jump straight away with you. Who is your favorite celebrity teeth? Basically your client. What do you like the most about them, their smile?
Well, you know, cosmetics prevail more to the women than to men.
Definitely.
In general.
Yeah.
So women are beautiful and men are handsome, kind of a thing. And bearing that in mind, I think Deepika Padukone has a very beautiful radiating smile when you look at it on her face and her entire composition. And I definitely think she takes that one away.
Definitely. I think Deepika Padukone is interesting because literally every Instagram photo that you see of hers, it's just so happy and she smiles so wide. So, Doctor, you are the Bollywood smile doctor. What is your secret? We want to know.
Well, Nidhi, the thing is, I treat everybody on a human basis.
Okay.
Like I say, I don't make movies. I fix teeth. So what I see, you know, the word celebrity, inverted commas, I deal with normal human beings. I understand their wants. I understand their desires. I try to figure out the shortcomings and then offer them a solution around what they want and what I can create.
That's awesome. So, Doctor, did you always want to be a dentist, or what made you want?
Actually, it was like this. When I started, when I finished my 12th standard, I had 1 mark short and I wanted to get into MBBS. And with that 1 mark, there was a difference of like 20 seats in between. So I had to kind of settle for dentistry, but within 6 months of doing that, I was so happy I chose that. I just immensely enjoyed it and I continued to carry on that way.
So basically that 1 mark has brought you here. So guys, I hope you all are listening. This is a very inspiring story.
The -1 story.
-1 story. So, smile makeover, Hollywood smile, celebrity smile. So these are words that go around a lot on social media and etc. So what do you look for before designing a particular smile, or what is the process behind that?
So first, Nidhi, what you do is you listen to the patient's wants, what the patient's motivational focus is, what they feel is an issue with them, and then around that you try to structure giving them an answer. You reply to their desires and their shortcomings accordingly. Don't create you know, a huge monument in front of them which they are not expecting. They want a certain focus to be followed. If the focus is the whole smile, you design the whole smile. Otherwise, you go by their focus. Explain to them what the shortcoming can be. Sometimes if only that much work was done, or if a little more was done, and then create a result that looks best on them for a longer length of time.
That's amazing. So there's something, so usually people who work, generally everyone works, they always describe their work as it's long, it's tedious, but you are doing something that you love. So can you describe your work in a sentence? What do you do every day?
I each and every single day that I go to work, I never say I fix teeth. I try to create something. I try to create it to make it look natural and or enhanced more than natural for somebody who wants to use it on the catwalk or on the silver screen or to blaze across a screen or whatever. So the entire projection of what they're carrying off with them is based on what they need and wants are.
That's amazing. So, doctor, this is something that I wanted to ask you since the time you entered, and it's a little complex that I'm having asking you this. So when you're just generally walking down the street, or you're like, I don't know, walking your dogs, anything, so do you notice people's teeth around you?
No, I'm like a Dr. Jekyll and Mr. Hyde, Nidhi. So when I leave my office at 5 o'clock in the evening, I do not think teeth. My daughter's a dentist. We do not discuss teeth at home.
Wow.
I refresh my grey matter, and at 9:30 in the morning, I become Dr. Jekyll again.
Oh wow, that's amazing. So with celebrity, okay, now this is a question that I think all our audience wants to know, because since you work with so many celebrities, I think we need a little gossip, guys, don't you think? So with celebrity teeth, if you had a chance, you would want to change or work on, and why?
You know, Nidhi, if I could handle their schedules, their commitments, their endorsements, I would ask a lot of celebrities to get things done.
That's
but
true.
They are so frenzied. They're actually coming out of one door, getting into the next engagement, or doing a commercial, or taking a flight out and going outdoors for a shoot. It becomes very difficult to get a hold on people. They themselves know that they need things done, but the question mark, biggest question mark is time.
Time. So basically there's no one who you would probably want to...
It has to come to them. It has to come to them. It has to dawn upon them that, look, I got to do this because this is a drawback for me in my professional sphere, and then they come to you and they have it done.
Definitely. So there's a method that is common, which is commonly going around right now. It's called veneers. So can you tell us something about that? What is it?
A veneer is a thin shell of tooth-colored material, much like an artificial fingernail, which goes onto the surface of a tooth to make it look different, both in size, form, texture, color, everything. So what happens is you analyze the whole body, the age, the height, the complexion, the skin tone, personality, image aspiration, things like that, symmetry, and then you design a smile, much like designing a garment. A certain kind of person may look better in dark colors with folds. A certain kind of person may look better with stark white garments. So it depends how that person is structured. Correct.
Wow.
You design the smile to best suit the person, their requirement and profession, and what they are going to essentially be using it for.
So doctor, you're basically like an artist, because you're actually designing everything that goes on with their smile, and basically from scratch.
I have to agree with you in that, in saying yes.
Definitely.
It involves a lot of art.
Yes.
It involves a lot of shrinking down. You've got to be half a psychiatrist or psychologist, whatever you'd like to say, to understand the patient's needs and wants. You can't create an idealistic looking monstrosity.
True, true.
It just doesn't work.
Yeah, true. So doctor, the procedure, the veneers procedure, does it differ from person to person? How long does it usually take to?
So I've been doing veneers for the last 30 years now.
Wow.
And there are various kinds of veneers. The makeovers we do in our office, in a frenzied system called Bollywood, for example, which was why this all began. We start at 9:30 in the morning, and by 1:30 we're done.
Okay.
So the person comes in with one set of teeth, leaves with another set of teeth. But on a previous appointment, we have made some photographs and documentation, etc. And then we just go ahead and finish it. And I always start first thing in the morning with a fresh mind.
Fresh mind, definitely. That's actually very important. So usually many procedures, they don't look natural, but yours look very natural, and it's like it was always there. So what is the procedure to go about making it look natural?
You know, you can make something look unnatural if you want to, but that is terrible. It looks like chiclets. That is what a lot of people in Hollywood like. They like white chiclets.
Yeah, that's true.
I do not like that. The Americanization of a smile is one part of it. Then we live in Asia, which is a conservative kind of a system, and Europe in between. So I try to design the quality of a European smile with a little bit of zing like they have in the West. Because that's what our people can carry off the best.
Wow, that's amazing. So, doctor, can you please explain, does this procedure hurt Is it hurtful or is it just...
Not at all. You can come in for veneers in the morning. We give you a little local anesthetic with a syringe, 2 drops. You're frozen. You sit on the chair. It's like doing multiple fillings. Okay. You finish it. You start at 9:30. You can get up and stretch in between teeth, but not while I'm doing one tooth. Okay. After I'm done, around 1:30, we do a polish and you're gone. And then come in for a checkup the next day, and one after a week or 10 days, and one after a month, and you're finished.
You're done. Wow. Yeah. So how long do they last, doctor?
They last indefinitely. It depends on the kind of food you eat, the hygiene you maintain, how well I've done it, what quality material I've used. It depends on how your body keeps over a long length of time, the chemistry of your saliva. I mean, I can go on and on and on. Okay. But they last indefinitely, such that there's no assurance that they will last 10 years or 20 years or 30 years. It depends how you keep them.
Yeah. So basically, they're not high maintenance. It's something that you should
you brush and floss just as normal.
Okay, that's it. Okay. So who is the right candidate to undergo such a procedure? Is there any age that somebody has? I would
generally treat people who are above 18 years of age, because the body has developed to a point where the gums are not going to withdraw so much more now, and everything is more or less stable. And at 18 years of age, you can go and execute the procedure. You can do people who have crooked teeth. You can do people who have broken teeth. You can do people who just want their teeth enhanced. You can do people who have yellow discolored teeth, staining because of, coffee or cigarettes, or, in India we have pan staining or whatever, and stuff like that. So it applies, or people with spaces between their teeth. You can do a multitude of situations where you want to enhance. What generally happens is somebody who wants enhancement comes into you, and then they want to get a much better impactful smile. So you'll end up doing a little more. It's like if I only did your space, say you came in with spaces and I only did your spaces, I would take you 65% down the street. But if I did enhancement on you, it would be 85-90% down the street. While you're doing it, you may as well get done with it.
Done with it, definitely. Okay. So doctor, you are a visiting surgeon here at Cocoona, and how often will you be here, and what are the procedures and techniques that you will be performing here? If our audience wants to come and get it done from you.
I intend to be here, Nidhi, almost every month, within 5 to 6 weeks, if at all.
That's awesome.
And intend to complete as much as I can on a visit. So if there are more clients and I know already that they want to get it done, I never work on anybody in the first visit, so I have to do a consult first. So say I've done 3 consults and I know 3 or 4 people want it done, I will space that out, I will give it enough time. I always give my work enough time, so if I'm going to take 3 hours, I give it 5 hours, so I can create it rather than just hurry and do it.
That's definitely.
And I will then clear my plate, do everything, and then go.
So guys, you all know that he is here, and you all know where to come if you have anything teeth related, because he is literally the master right here sitting at Cocoona. Thank you so much for staying tuned till now, audience. So just remember, in the beginning of the episode, I told you all that you all have a chance to win a free teeth whitening from none other than Dr. Sunil. So all you have to do is, you have to post a photo of your favorite celebrity smile on Instagram with the caption, "I love their smile." Make sure that you're following Cocoona Clinic on Instagram, post the picture, and make sure that you hashtag Cocoona Clinic and Dr. Sunil Bhoolabhai, and we will be choosing the winners and contacting you directly. But please make sure that your profiles are public, because then it will be harder to find. And doctor, before we end the show, there's always something that I ask so that our audience take away a little something from the episode. Can you please give us a beauty advice for beauty doctors?
So I would say that, avoid eating, to keep your teeth nice, shiny and white. Avoid eating intensely colored foods. That also includes something like smoking, which can discolor teeth internally for a long length of time if it's done. And when you have your beverage like tea or coffee, try not to have it dark all the time. Try to put a spot of milk in it so that the dark effect of it doesn't come upon your teeth.
That is amazing. Thank you so much, doctor, for joining us today. It has been an amazing conversation, and just knowing that you have worked on Shah Rukh Khan and Salman Khan, I want to take a selfie with you after the end of this episode. Thank you so much for joining us. And guys, do not forget that this is just the beginning of season 2. We're going to have so many other things coming up. Make sure that you participate in the giveaway, and God bless. Bye.